So on the topic of hip pain, we're going to go through a couple exercises. The first one is to be getting out of your pain. So like there is always this debate of does it need to be strengthened, does it need to be lengthened, and this hip flexor kind of debate is going to go on and on. But usually most of the time it needs both. We need to be able to work through things. So one of the things that I like to go through first is a stretch, which usually isn't going to be this problem solver for this, but what it's really going to be helpful is reducing pain. So it's part of the equation of going through this is not just about like getting to the bottom of it and solving it. Like that's usually more a time component that's going to be working through this. So we got to work through things that are going to make it feel better just in the meantime, because nobody wants to deal with constant pain. So we can go through some relief positions. So one of the ones that's definitely for pain. So if I had right-sided hip pain, we can go through a hip flexor stretch. And this is kind of all over the place and we want to work through this. So one of my tidbits on this is working through the hip. So typically here we're going to work into getting some length and some stretch through here. Some key things that I like is being able to stack ourselves and going into a counter nutation. So being able to take the hip and the pelvis and kind of think about dumping water out the back or tucking our tail are good cues. You're gonna feel a little stretch here. Then we're gonna bring the arms up towards the sky. We're gonna rotate towards the hip that's down, and then we're gonna extend back. And we're gonna kind of feel that stretch kind of all through here. And then I focus on breathing deep into my belly. So pelvic tilt, tall, rotate, over, and then breathing. And my thing about getting that breath as far down as I can. What that's going to help do is lengthen this area. It also helps us work on that belly breathing, diaphragmatic breathing, so we get a little bit 2-for-1 for that. If you get that and you want a little bit more, some advances that we can work on is getting a little bit more internal rotation. When I first did this, my foot was a little slightly internally, or like my foot was internal, a little external rotation of the hip. If I want to get a little bit more internal rotation of the hip, I can get so my foot, knee, and hip are all in one line, and I can work on that same thing. Posterior pelvic tilt, feel that stretch coming through, holding that tilt, coming through and extending back. And that's going to really intensify that stretch. And you can keep working this so you can even get that foot on the external side of your knee, on the outside of your knee, so you can kind of work through here and still get a little bit more of that stretch. And you can kind of play around with your hip to kind of see where you get the most stretch at.